I'm delighted to be joined today by Grant Quertermous, curator at Tudor Place, a historic home in Georgetown, which Grant has very kindly displayed behind himself. So thank you, Grant, and thank you for being here.
Oh, my pleasure. It's glad to be here today, Al. Thank you.
So we're going to be talking about the experience of pandemics at Tudor Place. But I think just to get us started, Grant, could you just tell us a little bit about Tudor Place in general and its background?
Sure. For anyone unfamiliar with Tudor Place, it's the home of the Peter family in Georgetown from 1805 until 1983. It's a 5.5-acre estate in what's known as the Heights of Georgetown, near the corner of 31st and Q Street. The original owners of Tudor Place were Thomas and Martha Peter. She was actually one of Martha Washington's 4 Custis grandchildren, and Thomas Peter was the eldest son of Georgetown's first mayor, Robert Peter. The house that, as you mentioned, you can see behind me, was designed by a family friend, the architect Dr. William Thornton, the same architect who designed the Capitol building. And Tudor Place actually remained in the Peter family, passing down from one generation to the next until 1983. The last owner, Armistead Peter III, the great-grandson of Thomas and Martha Peter, created the foundation that received the house and the collection upon his death. And so today, Tudor Place is a historic house, museum, and garden. The collection includes about 18,000 objects that all relate to the Peter family and their nearly 2 centuries of living at Tudor Place. And that also includes several hundred objects that were formerly owned by George and Martha Washington that Martha Peter acquired after Martha Washington's death in 1802. And in addition to this museum collection, there's a very large family archive of papers that include correspondence, financial records, diaries, and even photographs that help us learn about not only the Peter family's experiences at Tudor Place, but in Georgetown and in Washington for those almost 2 centuries as well.
Thank you. So when we got started, we had a slide up that showed the cover of a book we'll be publishing that you've edited kindly for us, called A Georgetown Life. It's due to come out this fall. I was wondering if you could tell us a little bit about the story behind that book and the remarkable woman who's at the center of it.
Sure. So Britannia Wellington Peter Kinnan was the youngest daughter of Thomas and Martha Peter. Thomas and Martha were ardent Federalists. They actually named their 3 daughters Columbia, America, and Britannia. So Britannia is their youngest daughter. She's born in 1815, and she was actually educated locally in Georgetown, as opposed to her 2 sisters who were educated in Philadelphia. She attended Visitation, then it was known as the Young Ladies Academy. Britannia marries a naval officer, Commodore Beverly Kinnan, in 1842, and their only daughter is born the following year in 1843. Now, tragically, just 4 months later, Britannia is widowed when Kinnan is killed in an explosion aboard the USS Princeton in February of 1844. So Britannia returns to Tudor Place, and she lives for the next 67 years, where she raises her daughter and later generations of the family as well. And starting in the 1890s, when Britannia is in her late 70s, her grandchildren begin to interview her to ask her about her childhood at Tudor Place, about what Georgetown and Washington, D.C. was like in the past. And she tells them about meeting famous historical figures such as Daniel Webster, and including anecdotes about how people like Martin Van Buren got his carriage stuck in the mud on the trip up what's now 31st Street, or about Georgetown during the Civil War. And especially for those of us who interpret the house now, very important information about the enslaved who labored at Tudor Place earlier in the 19th century. Now, the notes where her grandchildren recorded her responses survive in the Tudor Place archive. So that was, the notes is the manuscript that I started working from in editing what became this book. So what's remarkable is Britannia's grandchildren are really doing oral history with her in much the same way that we do oral history today. They're just, before the advent of recording, just writing it down as she's saying it.
Yeah, thank you. That's really helpful context for the rest of our discussion. So before we get into a couple of specific episodes of pandemic at Tudor Place, I was wondering if you could just tell us a little bit about how the sick were cared for in the 19th century, so that if an inhabitant of Tudor Place, became ill with a cold or a flu, what were the kind of remedies that were available, access to medicine, those sorts of things?
Sure. Well, a prominent and wealthy family like the Peters would have had several doctors available to them in Georgetown who made house calls. But then again, if you look at the fact that, only five of, excuse me, only 5 of the 10 children born to Thomas and Martha Peter actually lived to adulthood. In the 19th century, an illness or a disease that today could be remedied by a round of antibiotics or even outpatient surgery often proved fatal. For example, in 1820, the Peters had a daughter, Columbia, Britannia's older sister, who died of what Britannia calls a bilious fever, likely either an attack of gallstones or possibly even a ruptured appendix, something like that. Again, easily treatable today, ultimately fatal in the 19th century. And Britannia talks about a number of physicians who assisted the family in various things, including one that I'll talk about in just a moment, who actually died during the cholera epidemic of 1832 while treating patients during that outbreak.
Thank you. Let's talk about the cholera outbreak in 1832. Can you tell us a bit about what happened generally in the city and then how it was experienced at Tudor Place?
Sure. Well, I'll say, just as a bit of context, this was really the first cholera outbreak, or the first wave of cholera, excuse me, to hit the United States. Cholera is certainly one of the more unpleasant epidemic diseases as far as symptoms. For lack of a better term, and because it's lunchtime, let's just call it a gastrointestinal problem. But, people at the time didn't know what caused this highly contagious and fatal disease. It, of course, is a disease that's caused by drinking contaminated water or eating food that's also been contaminated with fecal bacteria. Except in the 1830s, germ theory was virtually non-existent, and people thought that illnesses and pandemics like cholera were caused by miasmas, breathing noxious or foul air. Now, the 1832 outbreak was first observed in New York City earlier that summer in, I believe it was June, and by August, it had made its way to Washington and really lasted for almost 3 months into October. And of course, the thing that helped cholera spread so quickly was all these transportation routes, these roads and these canals and everything, the ways people were traveling in the United States at that time. And again, nobody knew, even in Washington, what was causing the outbreak of cholera. People thought maybe, in fact, preachers in some Washington churches were saying that it was caused by consequences of living to excess, intemperance. And my personal favorite, some thought that actually the consumption of fruits and vegetables were the cause. So the victim at Tudor Place, and that was really associated with this outbreak, was the estate's enslaved gardener, whose name was Will Twine. Britannia writes that one morning Will came to work as usual, but then returned home before breakfast. What's also interesting about Will is, even though he was enslaved, he actually lived out, which meant that he lived off the property with his free wife in an area of Georgetown that was known as Lee's Hill. It's the area up close to what's now Wisconsin and about R Street, a couple of blocks from Tudor Place. So the Peter family then sent their son, George Washington Peter, over to inquire about Will. He sends for a doctor, but Britannia writes that Will died before the doctor even got there, with her brother George at his side. And what's even more interesting about this is we know the exact date that it occurred, because the Peter family's friend, Anna Maria Thornton, the wife of Dr. William Thornton, actually records it in her diary. She writes that on September 14th of 1832, she received a note from Mrs. Peter, who noted that she had lost a manservant and had several others sick and has really had a hard time of it. And what I think is especially interesting about the cholera epidemic of 1832 is that even though the Board of Aldermen, sort of the governing body for the city council at that time, didn't know what was causing the disease, they took measures to try and alleviate its spread, much in the same way that we're doing now, almost 2 centuries later. One of the primary measures they took was to prevent the gathering of large crowds or assemblies. They recommended that religious bodies refrain from holding meetings. They put a 90-day ban on theatrical performances. They banned the sale of ardent spirits for 90 days. And like I said, even pushed to prohibit the sale of fruits and vegetables. If they really did that, it's kind of amazing there wasn't a massive outbreak of scurvy, but that's another thing. And What's interesting too, another young woman in Georgetown, Anne Schaff, who Britannia mentions in her reminiscences, who was about 10 years older than Britannia. Anne actually writes a letter to her cousin describing this time period in Georgetown's history as well in 1832. And she says that, and I'm going to quote from the letter, "It's been very bad and is not perhaps, as you think, confined to the lower streets, but I've heard of more cases in the high parts of town than other parts. There have been cases all about us and around us, and they were quick in their termination." Now, what I think is interesting about that is she's talking about the heights of Georgetown, the area near Tudor Place, and this parts of the city, showing that there were just as many cases up there as the lower parts of Georgetown, down near the canal and the wharf and that area. And, another well-known victim of the epidemic was actually the mayor's wife, Marcia Burns Van Ness. Of course, John Peter Van Ness was DC mayor at the time. His wife, a philanthropist, they lived at a large house on what's now Constitution Avenue, designed by Latrobe. She's actually the founder of the Female Orphan Asylum in Washington in 1815. She was actually nursing victims and contracted the disease herself, dying in September of 1832. And I think it's a good reminder that an epidemic like that will claim victims from all strata of society, as I've mentioned, from an enslaved individual to one of the wealthiest women in the city of Washington.
Yeah, thank you. That's fascinating. Are there any statistics about the number of deaths in the city as a whole?
Yeah, I know I've seen them. I can't unfortunately recall them off the top of my head right now, but and most scholars seem to agree now that the numbers probably should be elevated, that the numbers we have are probably not a good, accurate representation of the number of victims from that outbreak.
Yes, thank you.
Sure.
I just want to remind everyone that if you'd like to submit questions for Grant, please use the Q&A, and I'm sure he'd be happy to answer them. So we'll move on in a minute to the the big influenza outbreak of 1918 that we're seeing so many resonances with now. But I was wondering if you could tell us a little bit about the period in between, and particularly the Civil War. That I know, many historic homes like Tudor Place were used as hospitals at that time. And was that the case with Tudor Place? And could you say a little bit about their experience, I guess, of health and illness during the Civil War period?
Sure. Well, actually, Britannia, who was, again, owner of Tudor Place at that time, took great steps to ensure that Tudor Place wasn't seized. I should say that she was very much a Southern sympathizer. She was very proud of the fact, that she had actually served in the wedding party of Robert E. Lee. Robert E. Lee was a cousin. He, of course, had married her first cousin in 1831, and so she was as a very outspoken Southerner. Britannia was actually traveling with her daughter Marky when the Civil War broke out. They were in the Shenandoah Valley of Virginia, in the city of Stanton, and then they moved to Richmond and Petersburg and finally Norfolk. And it's while she's in Norfolk that she hears about buildings around Georgetown being seized. The seminary building, which was a girls' school, was seized for use as a hospital. And of course, across the river in Virginia, Arlington, her cousin and husband's residence, was seized by the Union Army starting in, I believe, May of 1861. So Britannia starts trying to get back to Georgetown to prevent her house from being seized, especially after she learns that her tenants, who were Southern sympathizing themselves, had actually fled as well, the people who were leasing Tudor Place from her while she was gone. So it's actually while she's in Norfolk, through her late husband's connection, she gets a meeting with Confederate General Benjamin Huger, who's commander of all of coastal Virginia and North Carolina. And he makes arrangements for Britannia and her daughter to board a flag of truce boat, a neutral vessel basically in the middle of Hampton Roads. So she rides out to the center of the bay in one boat, gets on a neutral vessel, and then goes all the way to Baltimore. And from there, she comes back to Washington, arriving on January 1st of 1862. And several months after that, she actually decides to take in boarders as a further measure to prevent the seizure of the house and the property. And what's so interesting about that is her tenants are actually Union officers and doctors associated with the hospitals in Georgetown. And remember, Britannia is this very Southern sympathizing woman. And here's this, with a house full of Union generals and doctors. Another interesting family connection, her future son-in-law, Dr. Armistead Peter, who marries her daughter Marky after the Civil War in 1867, also very Southern sympathizing, but actually ends up working for the Union at one of the hospitals in Georgetown, the same hospital actually that Louisa May Alcott served in briefly. And she, of course, writes about her experiences there in her book Hospital Sketches, published slightly later after the Civil War.
Thank you. That's some fascinating connections.
Yeah.
We've had a couple of questions come in about the cholera epidemic. Okay. So if you don't mind, go back
Sure.
there. So Fritz Heinzen has asked, was there much flight from the Georgetown area to avoid cholera?
That's a good question. I'm not especially sure. I think, people, again, really weren't sure what caused it. So that's, yeah, I'm sorry I don't have a better answer. I know, for instance, the Peter family remained at Tudor Place. They, of course, had several residents. They had an agricultural property out in Montgomery County, Maryland. They owned another farm of about 100 acres in what's now northeast DC, but they actually remained at Tudor Place.
They didn't leave the city
Yeah.
for the country.
Yes.
Right? Okay, that's interesting. And then we have a question from Robert Wallace. Why did the 1832 epidemic end after 3 months? Do we have a sense of why it started and ended what might seem abruptly?
That's, again, a good question too, and I apologize for not knowing the answer of that one. Again, most of my research focused on the 1832 epidemic is focusing on the Peter family and their experience during this time, but I don't know if it's, obviously it's not a seasonal thing, but I'm sorry.
Sure, no, I understand. It would be interesting to know if whether the measures they took had any effect, or whether they were, simply sort of doing the best they could at the time. Great. Well, thank you. Why don't we move on to the 1918 flu pandemic, which, I think, more than 30 million people around the world perished. Certainly the largest event of its kind in modern history. Can you tell us a little bit about the specific experiences at Tudor Place during that time?
Sure. So again, moving ahead to 1918, by this time, Britannia's deceased, and it's her grandson, Armistead Peter Jr., who is owner of Tudor Place. And I should say that he was really the prime force in getting Britannia to write down those reminiscences 20 years earlier. And I think it's actually through his daily diary that we learn about Washington in the midst of that 1918 influenza epidemic. And so to give, just a bit of background on that epidemic, really the first cases appear in March of 1918 in Kansas at an army camp where soldiers start to fall ill. And I should say too that you see references to this epidemic as the Spanish flu. That's really an incorrect term. It only became known as the Spanish flu because it was the Spanish press who were reporting about so many cases of it in Spain, whereas the press in the United States and other parts of the world were under a wartime censorship, basically. So they couldn't report about the fatalities in their own country. So the American press and other press start picking up on it and start calling it the Spanish flu. Well, of course, the outbreak coincides, with World War I. So later that spring and summer, as American troops are being sent to Europe, the flu, of course, travels with them as well. And the first wave tended to be mild. It tended to be not many more fatalities, I believe, than the seasonal flu. However, it's the second wave later that fall that proved so deadly. The second wave that was the result of a mutated strain of the flu virus that emerged in Europe late in the summer of 1918. And of course, one factor that helped it spread to the United States was, again, returning troop ships coming back from Europe. So the second wave shows up in Washington in the late summer, in August. And at least that's when the newspapers begin reporting on it, although it probably arrived in the city a few weeks earlier. But remember, of course, DC was a major transportation hub for troops returning from Europe during the First World War. And so this second wave was actually initially dismissed as something that only was affecting the military camps around the city. The first case noted in Georgetown was in late September of 1918. And even at that time, the DC public health officials were saying that the flu wasn't really anything to be concerned about, but things went downhill very quickly. Schools closed on October 2nd, and they actually remained closed until early November for about a month. Public gatherings, including funerals and worship services, were canceled, and businesses were put on a staggered operating schedule, not only to alleviate congestion just in the businesses themselves, but also on the streetcars, because of course streetcars were a primary form of transportation for commuting at that time period. So some of the same measures that people are talking about now for the metro were being enacted for streetcars in 1918. Georgetown University, as well as George Washington University, both closed in October of 1918 as well. And I know that the Georgetown Hospital saw a huge surge in admissions around that time, to the point where they actually closed several departments in the hospital to focus manpower and resources on the treatment of flu patients. Well, at Tudor Place, it was actually several members of the domestic staff that were stricken. Mr. Peters' personal secretary, a man named Louis Oliver, and the butler, John Hurley. Now, Mr. Hurley had only worked at Tudor Place for a few weeks when he fell ill with the flu, and we don't know his fate. If he survived, he didn't return to Tudor Place, as another butler was hired a couple of weeks later. However, Louis Oliver, Mr. Peters' secretary, did survive, and he continued to work at Tudor Place for the next 14 years. Now, Mr. Peters' diary provides us with a really vivid image of what things were like in Washington during the fall of 1918. And some of these descriptions could be of today. It's amazing how they echo with what people are writing about and what they're seeing today. He talks about Woodward and Lothrop, the massive department store in downtown Washington, was deserted. He wrote about walking down F Street and seeing people wearing masks, even some young ladies wearing gas masks. And he talks about the hospitals being crowded and just the overall serious situation in the city. There were actually more than 33,000 reported cases in Washington, D.C. from that epidemic, with about 3,000 fatalities. And what's amazing is most of these fatalities occurred within that time period of less than 12 weeks, August, September, and October of 1918. Another family member that's really impacted was Mr. Peters' future daughter-in-law, Caroline Ogden Jones. She was actually a Red Cross nurse at a debarkation hospital on Staten Island, a hospital set up to treat troops returning from Europe. And there was such a nursing shortage there on Staten Island that she was actually transferred to a civilian hospital to help treat flu patients for several weeks. Her mother, who was also in Georgetown, is writing letters back and forth with her. And her mother is discussing, again, too, how everyone in DC is wearing masks. Her mother cautions her to avoid the New York subway as a further measure to prevent infection and exposure. And in one letter, Caroline passes along an account from a friend in Philadelphia who talks about seeing rows of coffins out on the sidewalk in front of all the undertakers and funeral parlors to accommodate this high number of fatalities around the city.
Wow, thank you. And lots of striking parallels with today, for sure. We have time, I think, just for maybe one or two more questions and comments. And we have a couple of questions that are really around, I guess, about differences in access to healthcare according to class. And maybe, you've mentioned a couple of times that some of the people who unfortunately perished at Tudor Place were the enslaved or the servants. And I wonder if you could just speak to that a little bit. The parallel today with essential workers and people who are maybe more exposed on a daily basis is really striking.
Mm-hmm. It is. And yes, as I mentioned, it was, especially in 1918, the servants. But in addition to that, the family wrote about knowing a number of friends and other people who were also victims of the 1918 epidemic. But yes, and I believe I know for sure both of the individuals who contracted it at Tudor Place did not live on the estate. They lived off property and just both the butler and the personal secretary lived off the property and just came in to work. So, yes.
Thank you. And do we know anything, this is another question that's come in,
okay.
were any modifications made to Tudor Place? Did people practice social distancing? Do we know anything about behavior?
I haven't seen any evidence of that. And what's especially interesting about that too is, as I mentioned, the initial thought was that the second wave of the 1918 flu was just limited to military installations around the city. And during that time, during the First World War, Armistead Peter Jr.'s son, Armistead Peter III, was actually in the Naval Reserve and stationed at several places around the city during that time. So, he's in and around a population where there were a high number of cases and commuting back and forth every day from Tudor Place. And it's definitely something that, again, it's interesting to look at this pandemic in 1918 now in the lens that we're all experiencing in the 21st century. And that's almost a whole nother lecture in itself.
Yeah. Well, thank you. I think that's a really good note to end on. I want to thank you for your time and for these fascinating observations about epidemics in the past and some of the connections with the present. So thank you for being here with us today.
My pleasure. I was glad to be here.
And I wanted to say that next week we'll be talking with Ananya Chakravarty, who is a professor at Georgetown University. She, during a class that she ran during this semester that just ended, worked with students to document their own experiences of our current pandemic. So her talk is going to be called Archiving COVID-19. And so hopefully we'll see you again next Thursday at noon. So thank you again, Grant, and thank you everyone for joining us. Stay safe. Take care. Bye-bye.